This is One on One. One on One is pleased to welcome Fran Gallagher, CEO. She's the Chief Executive Officer of the New Jersey chapter of the American Academy of Pediatrics. It's good to see you, Fran.
Thanks for having me.
Can we jump into a couple things right out of the box? There are people watching right now who are asking, hey, what's up with the immunization thing? And why do I still see certain folks out there challenging, questioning whether we should be immunizing our kids, getting them the shots?
It's a frightening situation because, in fact, decades ago, the diseases that were eradicated are now returning. We've got a measles outbreak of well over 1,000 cases that have been reported. It's a scary time with that, and we need to mobilize everyone, not just physicians, but families, everyone who believes that vaccines are safe, they're effective, and they're necessary to prevent vaccine-preventable diseases like measles.
Sorry for interrupting. No clear evidence, scientific, medical evidence, connecting these vaccines to autism, to any other?
Absolutely
So
none.
what is...
19 clinical studies have proven it. You have an anti-vax movement that is going on, and while it's small, it's well-funded, it's articulate, and they're present every day in their legislators' offices. What we need are the people who believe that vaccines are important, that they are going to save lives, that they prevent diseases, to pick up the phone or go visit their legislators, because there are far more people who understand and value the public health benefits of vaccines.
Fran, do us a favor. For those who don't know what the American Academy of Pediatrics is, they hear it, they don't know what it is. Do you regulate anyone?
We don't regulate anyone at all. We are a membership organization focused on children. We're looking at optimal health care, access to, and quality pediatric care for all children here in New Jersey. We have 1,750 pediatricians who are dedicated to just that. So we run a lot of quality improvement programs. We provide support for advanced primary care, which used to be referred to as the medical home, but stepping up to the plate to address a lot of different issues. And we do a lot of macro work, meaning policy, regulatory, legislative advocacy work.
You have corporate partners, you have folks that we know as well.
We do. In fact, we have, public-private partnerships are essential in making improvements in a state. We partner with Horizon as a foundation. We partner with...
To disclose, they are one of our underwriters and underwriters of public broadcasting. What is the partnership?
The partnership is around, again, quality improvement, access, increasing access to quality pediatric health care.
How?
So we've worked on projects with them about increasing immunization rates. We've worked on projects with them about increasing preventative oral health.
Oh, go back to oral health. I asked myself, what's the oral health and overall health?
They're connected.
How so?
They're connected because it is, in terms of, did you hear years ago about the 4-year-old young boy who died in Maryland because he had a cavity that was not treated, caries, and the infection traveled to his brain? It's very serious in terms of...
So we think oral health, hey, you get a cavity, you gotta go to the dentist, you brush your teeth, floss.
People think that it's part of growing up is getting cavities, but really what our goal is to prevent caries in children birth to 5, which it's totally preventable. And so it's working on, pediatricians have a key role in that. They look at doing an oral health assessment. They look at, in fact, making referrals to dental homes, and really counseling the parents about preventative, hygiene.
Is this a bigger issue in underserved communities?
It is.
Socioeconomic communities that are really struggling?
Across the board, you're looking at disparities. It's across the board. There's disparities with both gender and race. That is across the board, and we have a lot of work to do in reference to that.
Let me follow up on this. So another area that we have not talked about, that I was just talking to you about before you got on the air, that I'm fascinated by, is mental health. How significant, how serious are the issues connected to children and mental health issues?
They're very serious, and you're looking at a shortage of mental health providers. And so pediatricians who are specialists by training have stepped up to the plate and are caring for a lot of children with anxiety or depression or ADHD or those kinds of mental health diagnoses.
Or, excuse me, who could have experienced or experiencing what are otherwise known as ACEs, adverse childhood experiences,
Exactly.
which we talk about in our series. I know our team will put up our series called Right from the Start, NJ. After you put this Chiron up, if you put the other one up, we have a series called Right from the Start, NJ, which deals with 0 to 3.
Right, we're a member of that coalition.
Well, we have a great team of folks, but going back to this question, those adverse childhood experiences, poverty, violence, drugs, alcohol, in the home, a whole bunch of other things, that can have a tremendous effect on those children as they grow up.
It can, and you can see why it's so important to be strong supporters of advanced primary care, because in fact you need the pediatrician to be doing those kinds of screenings with ACEs to determine, and two-generational care, looking at what did the parents experience, what are the children experiencing, how do you intervene so that you permanently change the trajectory for health and educational outcomes.
This is big stuff.
It is very big stuff, and NJAAP, in
Your
fact,
organization.
Correct. It has been working actually in Camden. Camden.
Is that the pilot program I heard about?
Yes, it's
Explain
called
that real quick.
Spaces. It's integrating ACEs screening and better connecting school, early care and education, school nurses to advanced primary care practices, medical homes.
And what do we hope to find out of that?
What we hope to find out is early identification and linkage to services can change the trajectory. But we also have the challenge of looking at elevating the need for getting children on the legislative agenda the same as adults are. We have to support the adults in their lives, yes, but children are not small adults. Their pediatric issues are unique, and we have to take care of the pediatricians and the parents who are caring for young children.
Fran, last time I checked, children do not have a lobby down in the State House or in Washington with tons of money advocating for them, right?
Well, they don't vote and they don't pay taxes.
But they're all our responsibility.
They are, and they're our future.
You've just been listening to Fran Gallagher, who is the Chief Executive Officer of the American Academy of Pediatrics, the New Jersey chapter. Fran, I want to thank you, and thank you also for being a part of the coalition that we have formed around Right from the Start.
Absolutely. Thank you for having me.
This is One-on-One. I'm Steve Adubato. We're coming to you from the Agnes Ferris studio at NJTV in Newark. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, Hackensack Meridian Health, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, United Airlines, the Fidelco Group, and by PNC Bank. Promotional support provided by NJ.com and by AM 970 The Answer. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.